Good morning, everyone. Thank you for being here. We are so pleased and proud to announce the $900,000 federal grant from the Department of Justice to support our innovative warm handoff program. Of course, with us today is Senator Blumenthal, and we're here to publicly thank him and the rest of our delegation for the support for this innovative grant. And why is it innovative? It's innovative because we actually have a response team, clinicians, that actually respond to the overdoses, whether it's in a home, a parked car, in a restroom in some facility. It doesn't matter. We actually have people on duty with police radios, and they're dispatched to the scene along with the medics. And once the scene is safe, the clinicians actually meet with the overdose victim and then follow them to the hospital, and then also meet with their families, which is very, very important. The number of overdoses in the city of Waterbury in 2020 was about 840. The number of overdose deaths in 2020 were 94. The number of overdoses in 2021 was slightly less than the 840, 811. But I think the telling story, Senator, is the number of overdose deaths went down to 74, which is almost a 25% reduction in deaths. Now, there's a number of reasons for that, and one of them is the follow-up. I would really like to commend Officer Sergeant Nadine Amatruda and the Waterbury Health Department at the time, Jennifer DeWitt, who's now a Waterbury police officer, for putting together the information and applying for this grant with the support of our delegation, especially Senator Blumenthal. So we're here today to further bring awareness to this opioid crisis, which has not diminished at all, even with COVID. We're also here today to talk about what we can all do to reduce the stigma attached to people who are addicted to opioids. And let's understand it's an illness and it's real. And it can be treated and shall be treated. And Waterbury was the first city in the state of Connecticut to file lawsuits against the big pharmaceutical companies way back in 2019 and 18 and 19. And of course, every city and town in Connecticut followed thereafter. And we're proud of that. And as we all know, we are starting to see some of these lawsuits come to fruition and by way of settlements and agreements, which is going to funnel money back into the state of Connecticut for treatment and abatement education programs. So we're on top of this. We'll continue to be on top of this. But we really are so proud to be able to have this innovative warm handoff program, because it may well lead to programs in other municipalities around the state and around the country. This is a very aggressive approach to the opioid issue, and we're proud that Waterbury is at the forefront of it. Senator Blumenthal, thank you.
Thank you. Let me say right at the outset that I'm here on behalf of our delegation. Senator Murphy and I have worked together on this grant. I'm on the Judiciary Committee, and this grant comes from the Department of Justice. So I was directly involved, but we work together as a team. Kenny Curran is here today representing Senator Murphy, who has been instrumental in this work, and so has been Johanna Hayes. Our delegation really works together as a team, as does this team. I'm really proud of your leadership, Mayor, because you have provided the inspiration and the energy as a former police chief, knowing that we're not going to arrest our way out of the opioid crisis. It really takes hands-on work by a team of police and fire and public health and everyone in the city. And I want to especially thank Sergeant Amatrudo for the great work that you did on this grant. You know, we all stand here in front of the podium, we make speeches, we take credit, but the folks, the police and folks who are really in the trenches, frontline workers, deserve a lot of credit. And the mayor is absolutely right. This opioid crisis is not going away. In fact, just the opposite. It is getting worse. The numbers of overdose deaths in the state of Connecticut have been rising, not diminishing. The number of overdose deaths in most cities around the state of Connecticut have been rising, not diminishing. Waterbury is countering the trend in a good way. Waterbury is going against the trend or the flow of increasing deaths. And one of the big reasons for Waterbury's comparative success is the warm handoff program. This warm handoff program is cutting edge. It is the tip of the spear of where this country is going in terms of outreach and solving the opioid epidemic. The handoff program in Waterbury has been at work for 10 months at least, and it's a remarkable success story. The handoff program already has turned around a lot of the trends toward higher overdose deaths and lower amounts of treatment. And in fact, I have numbers for the first 10 months of the program: 354 overdose cases, 106 are in treatment or harm reduction or detox. That's 30%. The nationwide rate is 10%. So you can see Waterbury is way ahead of the curve. This handoff program is making a difference already without this grant. And this $900,000 is going to enable Waterbury to expand and extend the warm handoff program to provide more detox, more treatment, more harm reduction, more hands-on counseling and care. It's hands-on, not hands-off, but it's a warm handoff from police to caregivers, treatment, services that are vitally needed to break the cycle and enable people to overcome this disease. And the warm handoff program is an explicit and powerful recognition, in fact, that substance use disorder is in fact a disease. It's not a moral failing. We need to rid this disease of the stigma so that more people will come forward, so that more of our community will recognize the need for these kinds of innovative programs. And this Department of Justice grant is not only a recognition of Waterbury's leadership and Connecticut being at the forefront, but it will also enable an expanded program, more services, more treatment, more peer support recovery, more family support. And so when somebody overdoses, they're not just out on their own, on the streets. There's a warm handoff to real services, support, treatment. Not hands-off, hands-on. The warm handoff provides this kind of support. So let me introduce now, I guess, the Deputy Chief. Who has been so instrumental. And I also want to thank the Chief. Chief Spagnola has really been a leader in this effort, but I'm very pleased to introduce the Deputy Chief.
Thank you. Thank you. Good morning. The collaboration between the police department and the health department would not have been effective if it were not for the forward thinking and leadership of our police chief, Fernando Spagnuolo, and Mayor Neil O'Leary. Jennifer DeWitt, who was the Waterbury Prevention Coordinator and is currently in our police academy, Lieutenant Mike Stokes over here, Sergeant Nadine Amatruda, and many others worked hard to see this program come to fruition. We are excited to look forward to continue this amazing partnership to benefit our community. Thank you, Senator Blumenthal, for taking the time to highlight the hard work being done here in the city of Waterbury. And thank you to the Department of Justice for believing in our warm handoff program as much as we do. Thank you.
Thank you.
Thank you all for being here, and thank you, Senator, for coming all the way to help us in this effort. I want to thank our overdose response technicians, Cameron Breen and Rashni Vernix-Prini, who work every day tirelessly, no matter where the call is coming from, who the call is going to. They lead with compassion. I think that speaks to the spirit of the work that happens in our city. Time and again, we're reminded of the partnerships that are so important to make this actually work. And the work that they do on a daily basis is testament to the efficacy of those kinds of approaches. Leading with compassion, make sure that we're not just focusing on the problem, but the people affected by the problem. Thank you.
Thank you. Those comments were from Ashley McGuckin, of course, who's our Director of Public Health there in the city. And so just to wrap it up, we are, first of all, very happy and delighted to see all of you here on this beautiful January day. And it is quite a bit warmer than it will be 24 hours from now, we are told. So good timing, Senator. And we are pleased, of course, as always, to have Senator Blumenthal here. And as the Senator mentioned, Senator Murphy and Congresswoman Jahana Hayes have all been so instrumental in all the initiatives surrounding public health and during the COVID crisis, and frequent visitors to our city, to making sure that we have the support and the resources necessary. And this is another shining example of their commitment to our city, and we're so proud to have you here today. Thank you. Anyone have any questions?
Can you tell us specifically how the program works? You get a call that there's an overdose. What happens next? What's the procedure? How do the people that intervene, how do they intervene?
So we have trained clinician responders in this field that work for the health department. They are contacted immediately. In many cases, they will respond directly to where the overdose is and start the interaction with the overdose victim and their family, if they're able to do so. And as important, and that's very important, by the way, because we make connections with the families, of course, or their loved ones. And then the clinician then responds to the hospital that they're being treated at and interacts with the ER personnel. And then, of course, provides the resources that we have for treatment, education, not only to the family members, but also working through the staff at each of our hospitals to offer assistance and support to those overdose victims. So, you know, as the Senator points out, I'm really, really excited about the preliminary results of the number who are seeking treatment post-overdose. The national trend is 10%. We're up to around 30%, and those are great numbers, and we hope to continue those numbers. And you know, it's just amazing, honestly. You know, when you have that interaction, especially with the family members. So the family members are given our clinicians' contact information, and they provide support post the incident. So when the individual either enters into a treatment program or the family members are in contact with our clinicians to help provide continuing support post the incident. And that's, I think, as important as anything else. Thank you. Any other questions?
Speaking about education and treatment, I'm wondering like how the program might be working with like schools, like say universities, high schools, if at all.
That's a great question, and one of the things we're proud of is we were actually in the schools, Lance. We start age appropriate with our students, and this has been an awareness campaign. Let's face it, this opioid crisis caught us all by surprise, and as the Senator very accurately points out, it's just getting worse and worse. And so we feel it's so vitally important to get into our grammar schools, middle schools, and high schools and educate these students on the dangers of this opioid use. As we know, the number of deaths are rising across the country, and a lot of it has to do, of course, with the introduction of fentanyl. And that's an extraordinarily dangerous drug, and very often, almost all the time now, is responsible for the death of these people. And, you know, our kids need to understand, but most importantly, not only do our children need to understand, their parents and their siblings need to understand. And so that's a big part of this program. And that's why we're looking forward to the allocation with these some of the pharmaceutical companies, the allocation and infusion of funds into communities to further expand the education component of this whole crisis.
Let me just add, because the mayor is absolutely right. Fentanyl is the biggest killer of 18 to 45-year-olds. It is the leading cause of death. Fentanyl is the leading cause of death for people 18 to 45 years old. I know it's hard to believe, but more than car crashes, more than COVID, fentanyl is the cause of death for 18 to 45-year-olds. And the opioid crisis has been aggravated, talking about schools, by the fact that in-person learning was suspended for a period of time. The isolation, stress, anxiety of being out of school has aggravated the opioid crisis. And so this grant is a recognition that we need more of the hands-on kind of work that the warm handoff program will provide. And to go to the question about what it involves, when there's an overdose, there are two people on the scene, the police, but also a recovery coach. The recovery coach is the one who guides the overdose survivor toward treatment, services. There's a law enforcement function. The police are there. They're doing their job. But it's a cooperative effort between the recovery coach, who's there for that survivor to prevent more overdoses, and the police, who's there to do the vital law enforcement work, find out where that person got the drug, follow up in terms of investigation. Law enforcement has a role, but so does the recovery coach. And this grant will enable Waterbury to add at least one more, maybe two recovery coaches.
Thank you. Thank you, everyone.